Hello and welcome to CGTN, China Global Television Network. You're now watching us live on our special program, The Chat Room with me, Li Zhao. And today we're giving you an update on Chinese mainland, latest COVID-19 situations. What are the dominant strains in the Chinese mainland right now? How will the country cope with its Spring Festival travel rush with around 2 billion people traveling across the country? And how will the country cope with the infections in rural areas, places where medical resources are rather limited? Right, without further ado, let me first introduce our guest today. We invite 4 doctors from a range of departments, and all of them are from the second affiliated hospital at Zhejiang University School of Medicine. First, we have Dr. Wang Jian'an, also professor of cardiology. He's the head of the second affiliated hospital of Zhejiang University School of Medicine. Welcome, Dr. Wang.
Thank you. Thank you for having me.
Thank you. And also we have Dr. Jiang Jun. He's the chief physician and also acting chair of Department of Cardiology. Welcome, Dr. Jiang.
Thank you.
And next we have Ren Reng, the doctor of our old friend, associate chief physician at Department of Critical Care Medicine. Say hi to our audience, Dr. Ren.
Hi, thank you for having me again, Li Zhao. Did you have the full recovery?
I think not. I don't know if you can tell. I still have a little bit of lingering throat problem. Excuse my voice. And finally, we have Dr. Zhou Hui. She's a physician of Department of Infectious Disease, also at the second affiliated hospital of Zhejiang University School of Medicine. Welcome, Dr. Zhou.
Hi, thank you for having me.
All right, welcome to our show. You're now watching us live once again on CGTN, China Global Television Network. But before we dive into our discussions today, let me first give you some background information. Now, starting from today, January the 8th, China is downgrading COVID-19 management from Class A to Class B infectious disease. Officials dropped quarantine measures for international arrivals and also for those who have contracted COVID. The gradual relaxation first started in early December. That was about a month ago when officials found the prevalent Omicron variant to be less severe despite of being more contagious. Now, the ease of measures has in turn brought an unprecedented COVID surge in the country. I was among those who got caught in the COVID wave. As I just talked to Dr. Ren, I'm still in the process of recovering. So excuse my voice again. And let me remind you, we're now broadcasting live. You can always watch us live on our app, our official WeChat, Weibo from China, and also Facebook, Twitter, YouTube. Leave us comments if you have any questions for our 4 doctors. They'll be live answering your questions. All right, now it's time for our discussions. First of all, let me ask you, Dr. Wang, tell me the overall situation in your hospital right now. So as a whole, how many patients are you taking every day right now? If we compare the number to pre-policy relaxation period, did you see a significant growing trend, Dr. Wang?
Okay, Ms. Zhao, thank you for your question. So I would like to give you an example. So on the day of December 28th, we have more than 4,000 patients coming to visit our fever clinic and the respiratory clinic. So on the same day of last year, the number is only 700. So it's about 6 times high than that last year. So over the last year, so over the last week, the number of patients visiting the 2 clinics seem to drop gradually.
So we are definitely seeing a growing trend, right, Dr. Wang, as you just said. And I guess what kind of people are experiencing severe symptoms?
I think most of the patients, they are coming with the severe cough or even the respiratory stress, and very hard for them to keep in the breath is not so smoothly. And however, at the same period of time, we have more patients coming to the emergency room. So the number of the average daily visit is around 500. So which is almost triple the number of visitors before the policy relaxation. So among these patients, about the 10% who are in critical or severe condition. So most of them need to be admitted to our hospital. So even directly from ER room to the intensive care unit. So however, in the 2 or 3 days, over the 2 or 3 days, the number of critical patients is staying a little bit, or even showing us some kind of the downward tendency.
So we can see there is a growing trend, but right now it's turning downward, meaning it's sort of going to the gradual pace, right? So we're talking about ICUs, we're talking about severe cases. Then we should definitely brought Dr. Ren coming into our discussion right now. You're working inside ICUs, you know, you just finished your work, you just finished your shift, as we talked about. Tell me, what kind of people are really experiencing that kind of severe symptoms, and what are their symptoms for those severe cases?
Well, I'd love to start with the question this way. I think the people were more concerned about who is at a higher risk for the severe coronavirus disease. And I have to say, according to the evidence in epidemiology and according to our experiences by far, I would say, first of all, the age. And age is by far one of the strongest risk factors related to the severe COVID-19 outcomes. And in this way, we refer to the elderly patient who is older than 65 years old, especially over 80 years old. And other than that, we're more concerned about like the pregnant lady or people with the certain underlying diseases. As a matter of fact, you know, the more underlying diseases a person has, the higher rate of the severe COVID-19 outcomes he would have. And we may also concern about the people, you know, a group of the people who do not have the fully vaccinated or have the immune compromise. So I think it's quite similar with like other respiratory illnesses like influenza. And if you ask me about like what causing them or what kind of the symptom they may have, well, I have to say, since the COVID-19, the virus targeted on the respiratory system is the first one of the first and profound organs to be affected. So according to my experiences, maybe the dyspnea. So dyspnea is one of the most common symptoms that I can find in ICU. I mean, they're really hard to breathe. And consistently, they will have to really increase like the respiratory rate. Sometimes you will notice that the breathing pattern would be fast but shallow. And when the patient was admitted to the hospital, we may found like the pulse oxygen saturation. Remember, we discussed it earlier the other day, and they will fall below the normal range. And there's other symptoms related to hypoxia, which is like Dr. Wang mentioned before, like the fatigue, dizziness, headache, or even chest pain. But some of the questions that I got a lot often from the relatives is why the patient is turning into the critical EU phase, but I still do not have the high temperature, that I do not have the high fever. Well, I mean that a lot of people, when they turn into the critical EU phase, they don't have the high temperature. So we don't differentiate the patient, the severity based on the fever, the temperature itself. But you just watch out the pulse oxygen saturation, the low BP, and the less awareness for LEO patient. Thank you, Zhao.
Yeah, remember you said last time, a lot of the elder folks, they may not experiencing fever, right? Like the young experiencing like coughing or like a high temperature fever. But for those old people, maybe they can experience, like you said, fatigue, or they may they lose their appetite. Those are some of the common symptoms that maybe indicate that older people have already contracted COVID already. So
yeah, indeed.
Go to see a doctor immediately. Now, I know a lot of people are now really worrying about getting myocarditis. There actually has been growing evidence linking COVID infections to myocarditis in patients. Now, my question is for you, Dr. Jiang. Can you tell me what are some of the common symptoms of myocarditis? Give us some introduction so that no people can be, panic about if they got it or not.
So, okay, so as there have been reports about, the viral myocarditis caused by COVID-19 or even the mRNA vaccination, and people may have like chest pain, shortness of breath, or fatigue, and even syncope, which means loss of consciousness when they have this infection. But when we review the literature, actually, the prevalence of viral myocarditis before the COVID-19 pandemic, it's around 100 to 1,000 cases per million people. And a recent study from the United States, which is population-based, reported the rate of viral myocarditis caused by COVID-19 is about 450. So actually, the prevalence of viral myocarditis caused by the other virus or COVID-19 quite similar. And fortunately, you know, the fulminant myocarditis, which is a very severe form of the viral myocarditis, is quite rare. So people don't need to very worry about, you know, the myocarditis caused by COVID-19. But if you have the symptoms, just as I mentioned before, chest pain, shortness of breath, fatigue, and syncope, it's better to see a doctor, and you may need a further examination, such as a cardiac troponin test, electrocardiogram, and echocardiogram.
So I want to remind everybody who's watching our live stream, because different people have different symptoms. If you're experiencing something that you know, stronger or more severe than other people have described, you may want to go see a doctor, especially if we're talking about myocarditis, as Dr. Jiang has mentioned. So Dr. Jiang, my question, very direct, can it be self-resolving myocarditis?
Yeah, usually viral myocarditis are self-resolving, unless a very severe form, you need, you may need some medications, and most of the mild myocarditis is self-limiting.
Okay, as Dr. Jiang tells us, per million people, there's actually reports saying usually there's 1,000 to 2,000 people. So you don't need to have to worry too much, but if you're experiencing something stronger than we've described, you may want to go see a doctor.
Yes.
Another thing that a lot of people are concerning about is the new COVID-19 subvariant, XBB 1.5. It's been trending across China's social media, and the World Health Organization actually warned that it could be the most transmissible yet. So tell us about this Omicron variant, Dr. Zhou. What are some of its symptoms, and will they cause diarrhea? That's something that a lot of people are concerning about. Dr. Zhou?
Yeah, currently we detected Omicron XBB from imported case, but it hasn't caused large-scale infections in China yet. Based on the data from foreign studies, we noticed that XBB does have enhanced transmissibility and immune escapability compared to the previous strains like the BQ.1 and BA.5. However, it does not appear to be more virulent than its predecessors. So I know that some audience may be concerned about whether XBB is more abrasive to the digestive systems. Some patients infected with COVID-19 did develop digestive symptoms such as vomiting and diarrhea. However, infections with XBB subvariants did not come with more common or more severe digestive symptoms, and the respiratory symptoms remain the most common ones after infection. So I think it's not accurate to make the statement that XBB mainly attacks the digestive system. And talk about the two subvariants dominant in China. They are all belong to BA.5 variants. And the main subvariant spreading in North China is BF.7, while BA.5.2 is the predominant ones in South China. And in terms of the virulence and the transmissibilities, there is no differences between these two subvariants. But when it comes to the symptoms, we notice that they are not identical. But in general speaking, the symptoms are mild, and many focus on the respiratory symptoms, including like fevers, stuffy nose, runny nose, sore throat, and also like muscle aches and weakness, such as this. So
what I'm experiencing right now.
Yeah, yeah. The clinical differences that we witness in different parts of China, we think that they may be related to the climate, the temperature, and the humidity, and also patients' own immunity, age, and their underlying disease may also have a lot to do with the symptom differences. Yes. Regarding of the secondary infections, we don't need to get extremely worried about that. According to the data from in the UK, only 0.7 of those who get infected with BA.4 or BA.5 get a second infections with this same strains again. But the chance is higher if a secondary infection is due to the other strains like XBB. But for most people with normal immunities, the symptoms during the second infections, the symptoms is less severe than the first time. Yes, but also still, we don't exclude the possibilities that the severe case is also found, even though in those who get a secondary infections. Yeah.
Very thorough information, Dr. Zhou. Just tell us about the dominant strains right now affecting China right now is mostly still Omicron variants, but we cannot say anything for sure because right now the Omicron can mutate at any time because once it got hit to any people and it got a chance to get mutated again, especially as I mentioned, the Spring Festival travel rush is right upon us. Over 2 billion people will be traveling during the Spring Festival rush. I guess our next focus will be turning to those primary level healthcare centers. Now let's go to Dr. Wang again. Dr. Wang, tell us what is the role of primary level healthcare centers play in this fight against COVID right now?
Okay, I think for our medical staff working in the primary medical center, it's important. It is very important. First, they need to have plenty of the medication ready. So such as the medication for cough and the medication for the fever, and even the anti-COVID virus medication ready. So it is very important. So second, I think they need to pay more attention on the patients who have high risk for developing severe complications after catching the COVID-19. So also they should learn to distinguish the symptoms of critical early COVID cases. So they can try to figure out who are in critical situation, who are not. So for those patients with in critical situation, so they need to contact to the tertiary hospital or bigger hospitals. So in order to transfer these patients to higher level of medical center as soon as possible. Third, I think also they are one responsibilities is to provide supply the patient education about the COVID. Now also they need to inspire their community members to have the COVID vaccination, especially among the senior patients or patients with high risk, like the high risk factors, like the diabetic patients or the obesity patients. So that's all for my answering your this question.
So Mr. You are muted.
So I think about
I'm so sorry. I think I mute myself. I just coughed. Sorry, guys.
Okay.
But anyway,
Okay.
I think Dr. Wang just talked about how community level, or we said primary level healthcare centers need to get enough medication. Also, we need to early detect those critical cases, especially if you are with primary level hospitals, you need to detect those critical cases and then send them to larger hospitals, let's say first to second tier hospitals. And then patients don't need to worry too much as long as you got enough protection. Let's say that's vaccination or you got enough mask on, you don't have to worry too much. But as I said, different people may have different symptoms. So if you're experiencing something that's stronger than other people have described, you may still need to go see a doctor. Now, we know that right now, as I said, there is a surge in COVID patients across the country. There's still very strong pressure, I know, across hospitals in China and also in your hospital as well. Now, with all the pressure that your hospital is facing already, how do you manage to assist those primary level healthcare centers? I guess in terms of helping them, whether to train medical personnel, giving them instruction to drug usage, or the early detection of, as Dr. Wang said, severe cases. Dr. Jiang.
Okay, thank you for your question. That's very important. We already formed a partnership with more than 30 hospitals, for example, primary care centers, and also some clinics in the countryside. And due to the surge of the COVID-19 infection, we have to recruit more medical staffs to provide care for our patients. For example, other specialists, including orthopedics, surgeons, and maybe even OBGY physicians. So the first education is very important, to teach them how to treat with COVID-19 infection. So we provide online training sessions for those medical staffs, which benefit more than 700 medical staff in our partner hospitals. And second, we already built up a very robust telemedicine system, so we can provide telemedicine or consultation for our partners if they have difficult cases. For example, reading of the chest X-ray and how to use the medications, we can provide all kinds of this service to them. And also, if they have a very severe patient and need to referral to a hospital, we can also give them a green pass, a so-called green pass. And third, we have 7 close partnerships in the countryside in our province. We dispatched 12 to 13 physicians to each of these hospitals to work on site and give them support and also help them to care our COVID-19 patients. So that's very important to increase their capability, to manage this kind of patients, especially the critical patients.
Okay. I guess our next focus is about the Spring Festival travel rush. As I said, Spring Festival is soon upon us, within 10 days. First of all, I want to say happy Spring Festival to all 4 of you. I know it's been a hard month for all of you, working very hard. A great salute. You guys are the real heroes to this country. Anyways, during the Spring Festival travel rush, 2 billion people will be mobilizing across the country. Do you think that we need to separate those who haven't contracted COVID with those who recovered from COVID? Let's go to Dr. Zhou. She's an infectious disease expert. Tell us more, Dr. Zhou.
I think it is not really necessary to stagger the travel plans between those who have been infected and got recovered and those who haven't been infected yet. Because for people who recovered, their body has already developed immunity against the virus and they are not contagious. For those who haven't get infected yet, yes, they should be careful and always wear a mask and clean the hands regularly when they're traveling. But if they haven't received the booster vaccines, they could consider it before the travel. However, for those who have relatively weakened immunity or with severe underlying disease, maybe they should consider staggering their travels and also avoid gathering.
And also during travel, you may need to get full protective gears, like still putting your face mask on, and also keep social distancing whenever you can. Right.
Yeah.
So we got actually comments and questions from Facebook platforms. There's a question from Facebook, and he asked, how long after infection can I get the COVID-19 vaccine or booster? Let's get that question to Dr. Ren. Can you tell us how long after infection can this person get COVID booster?
COVID what? I'm sorry.
COVID-19 vaccine booster.
Oh, well, that's a really good question. I have to say, according to the Chinese expert consensus, I have to say a lot of people has unfortunately suffered from the COVID-19 positive infections will have to kind of the immunity to protect themselves. Maybe this period would be last for at least for 3 to 6 months. So according to the current expert consensus, so maybe you need a booster after 6 months. But if you do not have the fully vaccinated before infection, I would suggest you just to look for the advices for the health providers to decide how long can you get a booster. Yeah.
Okay, another question. I think Dr. Jiang is perfect for this question. He's concerned about myocarditis, and he asked, what kind of poses or anything I can do at home to help with myocarditis? Can you answer that question, Dr. Jiang?
I think for the mild myocarditis, resting is very important. You should avoid like strenuous activity 3 to 6 months after the infection. So that's very important. For patients with severe myocarditis, you may need to take some medications, prevent remodeling of the left ventricle, such as beta blocker and ACE inhibitors.
Okay, so we're still talking about if you're experiencing mild cases, maybe you can do something at home. But if you're experiencing anything severe, for those who are watching our live stream, first of all, I suggest you to go to see your doctor. That's what you need to do first, and then maybe medication. All right, let's go back to our discussion about Spring Festival travel rush. Now, we see there will be a surge in traveling in Spring Festival in Zhejiang too. So Dr. Wang, I think, do you think your hospital will face more pressure in terms of medical resources scars during the Spring Festival travel rush? And do you think your hospital can handle that wave?
Yes, I think there will be a massive mobilization in our country during the holiday. So according to some data models, the infection peak in China may arrive another peak, around the festival will arrive to another peak. So as for our hospital, I think we have a very good running system to face the possible surge of COVID-19. So we are so confident to cope with it. And there are several measures we already get ready. First, we focus on speeding up the patient flow of our emergency room. For example, we are the first hospital in Zhejiang province to open up a very special clinic we call the general respiratory clinic. So to increase our service capacity, so the clinic will be open from the 8 a.m. to 12 a.m. in the middle night. So we also have more consultation doctors sitting in the clinic. So the purpose of the clinic, of the very special clinic, is to relieve the pressure in the emergency room. As you know, many people they came to ER in the midnight may not be so critical. So for these kind of patients, so we can advise them to go to the respiratory general clinic. So we try to make sure the limited resources for those patients who are in real critical situation. So second, we build up we call the makeshift beds for intensive care and respiratory medicine. So now used to we have around 200 ICU beds, but now we extended the number of ICU beds to the 600. So we also established a very specific unit we call the step down units. So which have 200 beds. So the step down beds work as a buffer to provide an intermediate level of care between intensive care units and the regular general unit. So we also the hospital administration are making sure all hospital beds are under the same stratified management in the whole hospital. Third, we build a staff pipeline. We made great efforts to allocate human resources to support the frontline departments, such as respiratory medicine, emergency room, intensive care units, and step-down units. We encourage multidisciplinary discussions for high critical patients. So we standardize the clinical pathway for COVID-19 treatment. So we would like to ensure our patients' care keep consistent across the different areas over the whole hospital. So as possible as we can. So we even ask our hospital leaders, the president and the vice president, to take a call overnight at the hospital. So they could help facilitate strategy implementation, and it's very good for response approach. So make a necessary adjustment in a specific situation. We also encourage patients to make only essential in-person visit to our hospital. So some patients, they have mild symptoms of COVID-19, they can stay at home and treat themselves. So some patients, they just need to refill their prescription for their chronic illness, so they can get the prescription online. We updated our online consultation services. So the service now is 24 hours a day, 7 days a week. And so the insurance cover the reimbursement. So the prescription could be delivered to the patient's site. So more importantly, bedside equipment facilitation is very important. So such as the ventilator and the ECMO. So we keep emphasizing medical efficiency. For example, we have optimized and updated admission and discharge criteria for ICU and the general ward. So we try to make sure the limited medical resources are running more efficiently. So thank you.
I remember, Dr. Wang, I think you said very fully, you talk about the emergency rooms. You guys have been expanding the number of emergency rooms, also includes ICU beds. You've also established a new thing called buffer zones. We call step down units, right? That's
yes.
When patients from ICU really transfer to this buffer zone. If they are not still at the very critical conditions, they will be transferred to this buffer zone. And you also opened the online services, and it's running 24 hours right now. We actually talked about this last time. Remember, Dr. Ren?
Yes.
Yes, you guys talk about how you're on the list as well. I remember Dr. Tong, she's also on the list for the online services for the doctors, just to make sure that patients coming to hospitals can get effective and also efficient treatment. All right, we got more questions. It's very popular for our live stream this time. Our first question is to, let's go to Dr. Zhou, and this person asked, will those who recovered from COVID still carry the virus? Dr. Zhou.
Can you say that again?
Yeah, so will these people who have already recovered from COVID, will they still carry the virus?
As I said before, for people who have recovered from the COVID-19 infections, their body has already developed the immunity against the virus. for these people, they are not, they did not carry the virus, but it seems that they can get infected again. So for this situations, they need to distinguish about rebound possibility from a second infection. So a rebound possibility case normally occurs within 2 to 3 weeks after all the symptoms went away. The patients generally has no obvious symptoms, but there are still some residual virus remain in the body. So they test positive again. But in this case, these people are not contagious. But for people who got a secondary infections, it's a different situation. They still could easily infect other surrounding persons, and they usually suffer from COVID symptoms again. So for these people, they still carry the virus and can be contagious. Yeah.
So we're talking about 2 situations right here.
Yeah. Yeah.
The first one is for those who may get reinfected. Those people, they are not contagious, but they may still carry small or like a limited amount of virus. But for those who have already recovered from COVID, they may be carrying virus, and those kind of virus can still be, I guess, contract by people around you.
Yeah.
Another question from our Chinese platform: can vitamin D protect COVID? Let's go to Dr. Ren for that question. I want to know that too. Can we take more vitamins to protect our body?
Well, for my personal opinion, that we don't have some kind of the evidence from the literature that to prove that if you intake higher amount of the vitamin, no matter it's vitamin C, vitamin E, or vitamin D, can really boost your immune system. But on the other hand, I would say that maybe it's kind of a better option. Why not? Because it's during the winter time, right? So during the winter time, we just lack of the sunset. So why not? But in this case, I don't think that, or at least we don't have enough evidence to say that if you intake enough the vitamin C, that you can just protect you from the, get infected from the COVID-19. And once again, I wanted to make myself very clear that I believe that only thing that you can just protect yourself from COVID-19 is to get yourself fully vaccinated.
You just mentioned vaccination. I think a lot of our overseas audience, they are really want to know more about vaccination. And this person asked, my kid did not get the second vaccination at the required time because of the pandemic. What should I do? Should I start him from the very beginning? Let's go to Dr. Jiang for this question. So his son did not get the second vaccination at the required time. Maybe that's, I think 6 months. Should him be starting over from the very first shot, Dr. Jiang?
So, okay, I'm not an immune expert, but personal suggestion is to receive a second dose as soon as possible, and maybe receive a booster shot 6 months later. That's my personal suggestions.
Because there are lots of different kinds of vaccinations. Here in China, we have various kinds of vaccination across the world. There are different kinds of vaccination as well. So I think doctor gave you suggestions, but again, we also encourage you to go to doctors at your local community levels or local hospitals, ask for their advice as well, because your doctors may know your situation better than what we did here online. All right, next question. I'm yet to get a booster, but got infected already. Now I'm pretty much recovered. I want to ask doctors, after a short period of time, say 6 months or so, should I get the third injection or wait for another half a year for the fourth? Or should I skip this third and go to the fourth directly after recovery? Can we go to Dr. Zhou for this question? So this person did not get any COVID booster shot, no. But he asked, should he get the third injection or directly get the fourth injection? Dr. Zhou?
I think I think that he can got the third vaccinations, and then after 3 or 6 months got the booster in vaccinations. But I think that he should go to the hospitals and also ask a doctor again for his situations.
Right, because you know, vaccinations
Yeah.
are very very different. Here in China,
Yeah.
here in China, we take the inactivated vaccines, and in most of the Western countries, they're taking mRNA. So situations varies, and also your health conditions, we're not so sure about it here online with just few sentences. So our suggestion is, so you may want to go to doctors at your local community levels or local hospitals, ask for their opinions as well.
Yeah.
And this person also asked, we got this question already from our last live stream, but I think a lot of people are concerning about coughing, right? So this person, Dr. Wang, can you take this question? So this person said he's fully recovered, but he's coughing. Should he be worrying about that, about the coughing? I think I coughed, Dr. Wang.
I don't think it's necessary to be too nervous about the COVID. Even me, like me, I caught the COVID almost 1 month ago, but I still a little bit coughing now. So I think if the COVID will be disappear gradually, and if the patient has a proper lifestyle and have a good nutrition, and I think he will be recovered.
Okay. So let's have Dr. Ren remind us of those common symptoms for, I guess, normal people. By normal people, I mean those people with a huge majority of people experiencing. What kind of symptoms are the most people experiencing? And tell us what kind of symptoms are vulnerable people, those, you know, those people with underlying health conditions, and those seniors and maybe pregnant ladies. What kind of symptoms are they experiencing normally? Dr.
Well,
Ren?
actually, because I work in ICU, so actually I was more concerned about the patient with critical ill. And for me, like I would say the symptoms we got first is dyspnea, as I mentioned before. But actually, in the general clinic or in the fever clinic, dyspnea is not something that's really found in the common, because only we have a kind of diagnosis criteria for the how to differentiate between the, you know, the general or the critical ill patient. And one of the criteria for the diagnosis we use is the partial pressures of your oxygen in your arteria. So, I mean, for me, the most obvious symptom is dyspnea and hypoxia. But for the general, according to the general population, I would see the high fever in the very first 3 to 5 days, like the sore throat, runny nose, etc., as Dr. Joe and Dr. Wang mentioned before. But for me, as we talked about the other day, and I mentioned to the elder patient that if you live with one of the relatives together, I would like to suggest you just under the very close monitoring of that, whether the patient is as alert as before, and whether he had a good appetite, right? And whether he felt like drowsiness, sleepy, or they don't just feel right. And if by any chance, I mean, if at home, you can get like the pulse oximetry at home, maybe you can use it to have a daily monitoring. Yeah, that is my personal suggestions.
So we got feedback from this patient, this person, and he said, thanks so much for answering my question. It seems I've never been able to catch the latest vaccination, always one step left behind. But it's okay, as long as you get vaccinated. I think a lot of doctors, whether those we invited right here and also doctors across the country and across the world, they are encouraging to get full vaccination. What kind of various kind of vaccination, whether you're here in China or anywhere in the world, doctors and medical personnel are encouraging everybody to get full vaccination. That means both the first shot and also the second shot, and also the next 2 booster shots. Now let's go back to our discussion. Next question is, still about the severe cases. So let's still go to Dr. Jen. Those severe cases in rural areas, especially the large amount of paralyzed seniors, a lot of paralyzed people in rural areas. I'm not saying there's none in city areas, but those who can't go to hospitals, what should they do if they contracted COVID?
Yeah, first of all, I would like to answer this question divided into 3 parts. The first thing would be the everyday precautions, as Dr. Zhou, Dr. Wang, and Dr. Zhang mentioned before, that you should keep the social distances. And I know the Spring Festival is coming, and a lot of the relatives are rushing back home to see our dear relatives, especially our grandma, grandpa. But if your relative is not fully vaccinated, I personally suggest it just keep the social distance. But you know what, Zhao, really I wanted to make additional suggestions from my personal view is I knew that a lot of, the elderly population with kind of paralysis or stay at home, they may have a kind of comorbidities like diabetes, hypertension, hyperlipidemia, or chronic artery diseases. So it's really important just to have the maintenance medication to keep the symptoms, the underlying disease symptoms as controlled as possible. And you may want to talk about to your relatives for a kind of emergency supply for their prescription medications and plan medication consultations with the healthcare providers in case you need to stay at home for a period of time. Well, in my hospital, the second affiliated hospital of Zhejiang University, as Professor Wang just mentioned, that we have international hospital, as we discussed it before, that we can do the online consultation 24 hours a day. And also we can deliver the drug to your home. I think that's a good model that can be copied to the local hospital or the regional hospitals. And the third part would be for the people who stay or taking care of the elderly at home. I would say the first one, to set up the home environment, keep the air refreshing. And then I just emphasize on nutrition support, just eat well, sleep well. And the third one would be, like I just mentioned before, if you can, by any chance, get like the oxygen, pulse oxygen oximetry, and you'd better just do them daily monitoring. And once you feel like, well, the patient's kind of drowsiness and sleepy, just rush to the hospital, nearby the hospital as soon as possible. So that's overall my suggestions. Thank you.
I think last time you also talked about there are certain poses that you can do at home on your bed. Actually, you can turn your body upside down, meaning that you can actually turn your body from lying on the bed to like this. You said last time that you guys did that a lot in ICUs as well.
Yeah, we call this prone position. Yeah.
Sorry, will that pose help paralyzed patients as well?
Yeah, absolutely. And for the prone position, it's not only helpful for the paralysis elderly population. For the patient who have paralysis, we're more concerned about they have aspiration of the food, of the water, just inside of the lung. So I would say that prone position is not only used for COVID-19 severe critically ill patient, but also for all the paralysis, like the elderly population who we may concern about, like the aspiration pneumonia, virus pneumonia. So the prone position is really helpful. And I remember last time Dr. Guo from Peking Union Medical School just showed us how to do that. I know you can find a lot of posters, videos on the social media. So it's worth to teach everybody how to do it. And thank you for your remind.
Yeah, and also remember also, sorry, we talked a lot about last time. Also remember you said a device as well, oxygen, what's the name of blood?
The pulse oximetry. Yeah, the pulse oximetry.
That may be something that you can store at home that maybe help your grandma, grandfathers. All right, I think we are almost coming to our end to our live stream. You can still hand in questions if you have any, but first let's ask any final tips to people who are watching our live stream, because the Spring Festival is coming. Everybody, we want to go back home. We want to go back to our family. Any tips during the travel rush? Let's start from Dr. Wang first.
Okay, thank you. I would suggest our people, our travelers during the holiday to wear masks and hygiene your hands properly, especially when you are on the train or flight. And also, I would like to give specific advice to a lot of aging people and weakened people. Try to avoid the too hot scenery site where there are too many people gathered. It's not good for them. But at the same time, please not be too anxious. So hope everyone enjoy the upcoming festival holidays and have a happy family reunion.
Thank you so much, Dr. Wang. Happy Spring Festival. I know there are still 10 days, but happy Spring Festival. And also take care of yourself. I know it's a busy time for your doctors, so make sure you take care of your own body as well. So Dr. Wang just said we need to still make sure that you keep a normal amount of social distancing with other people, because at this time, there's a high risk of people around you may carry the virus. And also you need to still keep your mask on. It's very necessary. It's very necessary protective gear. So make sure you take your face mask on 24/7 if possible. Let's go to Dr. Jiang. Any tips for our audience?
So, okay, my suggestion for those people, especially those who are still not contracted with the COVID-19, it's very important, to get a vaccination, wearing mask, and also hand hygiene. So those maneuvers are very important to keep you have a happy and healthy Spring Festivals.
Also, thank you so much, and happy Spring Festival to you too, Dr. Jiang. So Dr. Jiang will talk about vaccination. As I said, doctors across the world, not just here in China, are encouraging vaccination, especially full vaccination. So vaccines still help a lot of times those symptoms, or whether you will be turning into severe or maybe death conditions. So vaccination is still very important, and we still suggest those of you who are watching our live stream, wherever you are, get vaccinated if you can. If you have underlying health conditions, make sure you go to your local hospitals and go to your local, whether your physicians are, go to them, ask for advice. All right, tips for our audience, Dr. Ren.
Well, I will just try to make myself really short. I just want to end it up with one sentence, just to stay with positive and stay with science. I believe that we can overcome this period really soon. And I sincerely that wish everybody happy Spring Festival. Thank you.
Happy Spring Festival to you too, Dr. Ren. And now let's go to Dr. Zhou. And first of all, happy Spring Festival to you too as well. And any tips for our audiences watching our live stream right now?
I would suggest all the audience, if you are being infected now, just do not take the multiple antipyretic drugs at the same time. It will be very sick, cause very side effects. And also during the holidays, just as Professor Wang says, if you stay with family members, especially with elderly family members, just pay close attention to their physical status. Yeah.
Okay, so make sure you know what are the conditions of people around you or your family members. That will help you and also help them as well. So we still have a few questions left over. I still want to get everybody's question answered. This person asked, Spring Festival is soon becoming. Happy Spring Festival, everybody. And what kind of food should I get during the Spring Festival to maintain a healthy body? He's asking about food. Let's go to first Dr. Jiang. Any food suggestions during the Spring Festival time?
So as a cardiologist, I usually always suggest people, to eat healthy, which means, take more vegetables and fruits, and maybe fish is good. And you should avoid eating too much like red meals. And that's my suggestion. Eat fresh and eat healthy.
Absolutely. Healthy is number one thing. Dr. Ren, anything to add on? Food suggestions?
Well, I just wanted to mention that because the Spring Festival is coming, and I believe that there will be a lot of alcohol consumption, right? So I just want to remind everybody, just watch out the alcohol consumption. And one more tip that I personally suggest you just intake the high protein food. So according to my experiences, like some of the elderly population in ICU, we'd like to give nutrition support with specific element of the high protein. But for the general population, it's fair enough that you just take the, as Dr. Zhang just mentioned, just eat a healthy and fresh food is okay.
Also, Dr. Zhou, you have anything to add? I see you nodding all the time. Anything to add on?
Yeah, I totally agree with what Dr.
Ren?
Yeah, and another thing is that I think you should drink enough water and do not stop smoking. Yeah, that's even without the COVID-19 infections, you still should drink enough water and stop smoking. Yeah.
Right, absolutely. Drink more water, but not alcohol. And
Yeah.
try don't smoke. I think this person talked about drinking water as well. And this person said, my grandma said for sore throat and coughing, ginger is good. She also said drink more water and keep warm. But she's not a medical expert though. But I think she said pretty much what our medical expert was trying to tell you guys about. Drink warm water. Sometimes maybe drink sweet water. Does that help? Sweet water also help, I think. According to my knowledge from last time's live stream, I think there's medical experts saying drinking sweet water, adding honey into your water, that also help with your sore throat. And also, let's see, this person also say in Malaysia, the Chinese has resorted to traditional Chinese herbs and it appears to work. I'm sorry, we don't have TCM, traditional Chinese medicine. We don't have expert this time, so we can't talk more. But if you want to know more, maybe we can arrange a live stream next time.
Yeah, indeed.
About TCM, because doctors, they're coming from all different departments, and a lot of times you can't just having one doctor is answering all the questions.
Yeah.
All right, let's get a little bit of summarizing today. And first of all, do not panic. It's not something that very very severe that may kill you, but at the same time, I think you should maintain a very light and positive mental condition as well. Like me, I got COVID like weeks ago. I'm still in the process of recovering. I still have a little bit of sore throat, but it's okay. Drink more water. Now we talk about we need to eat more high protein food like milk, eggs, fish. Those are some good food that may be great for you. And also, when your condition is a bit severe than other people have described, make sure you go to see your doctor. At this time, if you're experiencing what other people haven't experienced, you need to see doctor immediately. This time you need medical suggestions. And we don't just have doctors on site at hospitals. We also have online doctors. There are doctors working 24/7, especially in our Zhejiang. Sorry, let me double check with the name. The second affiliated hospital of Zhejiang University School of Medicine. They've opened up online services, right? If you have any questions, you can always go online and check with those doctors. And also vaccination, very important. Doctors suggest that you need to get full vaccination. But again, if you have underlying health conditions, you may want to get suggestions from doctors around you or your nearby hospitals. And next, for those people coming from rural areas, you need to get preparations of enough medication, and also you need to early detect those critical situation patients, and also you need to get vaccination. Those are some of the summaries that we talked about in our live stream. And once again, I want to thank our 4 doctors for taking your time. I know it's been a hard month for all of you. You guys have been working 24/7. A lot of you guys, as Dr. Wang said, a lot of the hospital leaders, they're taking phone calls even at midnight, because it's a hard time for China and a hard time for the world as well. That's why we're really conducting this kind of live stream, trying to share experiences, not just to patients here in China and to the world. All right, thank you so much again, and happy Spring Festival to all 4 of you and to your family members as well. Take care of your body, make sure that you stay strong, eat more eggs, drink more milk, and eat more fish as well. Happy Spring Festival, and thank you so much again. All right, that's our live stream today. Thank you so much for watching. And once again, our special program, the chat room, is finished. A very good talk with all four of our doctors. Thank you so much for joining us, and bye.
Thank you.
Thank you.
Thank
Bye-bye.
you. Thank you. Bye bye.
Yeah.